Have you ever been told that you had cancer? Or have your parents ever been told to be tested for bone marrow in case you needed it? Well, in my case, I unfortunately did experience this. But fortunately, I do not have cancer. I have a disease called sarcoidosis. Today I want to inform you about what sarcoidosis is and what comes with it. The next few minutes I have with you, I'm going to talk about the definition of sarcoidosis, its causes and effects, risk factors, treatment, its diagnosis, and what I've experienced since I've had it. First, let's take a look at what sarcoidosis is, then we'll take a look at its causes and risk factors. Sarcoidosis is a disease, a disorder that causes inflamed tissue to become tiny nodules on a body's organ. These tiny nodules can form with other nodules to become larger nodules, which can cause interruption in the daily bodily functions of those organs infected. It does not matter which organ that sarcoid chooses to become a part of, however, it will almost always affect your lungs. The cause of sarcoidosis is still unknown. There is a theory that suggests that when a vulnerable person is exposed to certain environmental agents, then this person can get the disease, but these environmental agents are still also unknown. Another theory suggests that certain organisms, including viruses and bacteria, can be possible causes. The risk factors with sarcoid, in the most severe cases but rare, is death. But in most cases that the doctors see, and even severe cases such as mine, they will see blindness in the eyes, if affected in your eyes, your changes in bone structure when in the bones, and also male infertility if it gets in your reproductive system. Secondly, let's look at the signs and symptoms, common organs involved, and the diagnosis of sarcoidosis. Most people can have it and not even know it, but a lot of the cases that doctors do see, because they go to the doctor and know that they have it, will experience an unexplainable cough, shortness of breath, and usually a high fever or chest pain. Some experience fatigue and weight loss. Organs that are commonly involved with this disease are your skin, your eyes, kidneys, heart, lungs, your musculoskeletal system, nervous system, and your reproductive system. The diagnosis for sarcoidosis is on multiple factors. It's on the symptoms that one is experiencing, which will lead to an x-ray usually of your chest, and when it's abnormal, the doctor will usually do a biopsy on the organ or lymph node, and that biopsy allows the doctor to look under a microscope to those tiny nodules to determine whether it is sarcoidosis. But if they can't, they can run what they call culture tests, which can take days or weeks, but usually will come back and tell you what you have. Once determined, the treatment will begin. The most common treatment is a steroid called prednisone, but with all steroids, it has many side effects, so doctors will usually try to stay away from it or get the patient off of it as soon as possible. Now I want to tell you what I've experienced through sarcoid. My first signs were shortness of breath and chest pain, and I also experienced a very high fever for about a week, ranging from 103 to 105. I had an abnormal chest x-ray showing a enlarged lymph node on the opposite side of my heart, and also nodules on my lungs. The biopsy was to determine that it wasn't cancer, but it was sarcoid. And the organs in my body have only been lymph nodes in my chest, my lung, or my throat, and nodules that formed on my lungs. My treatment has been pretty normal. I've had 3 biopsies determine that the lymph nodes were benign of the cancer and sarcoid was my disease. And I was on 8 days of prednisone, and that's out of 4 years, so not a whole lot of treatment as far as medicine. So you can see my experience is pretty normal with the common symptoms, treatment, and diagnosis. I just have to visit the doctor semi-annual to annually to check up on my progress. I've dealt with this disease for 4 years, and sarcoid can be serious because you may not know you have it, or in severe cases can lead to death. if ever experienced or encountered with it, you may want to watch for a severe chest pain with a high fever and shortness of breath. Also fatigue, weight loss, and these things probably are going to be experienced all together, not by itself. I hope that I have better informed you about sarcoid in case you or someone you know is ever encountered and experiencing what I've gone through. Thank you.
Wow,
That was awesome.
that was a good speech. I thought it was a good speech.